Alright, once again, good evening. I want to speak on the topic that says the importance of In-Vivo testing in dosage form evaluation. Introduction. Overview of dosage form evaluation. The process of dosage form evaluation is an integral part of drug development with a significant role in determining the safety, efficacy, and quality of pharmaceutical drug products and material. This process involves a series of testing that aim to assess the physical, chemical, and biological properties of drug formulation to ensure it delivers the desired therapeutic effect. Dosage form evaluation is a test to detect the real safety, efficacy, and quality of pharmaceutical products, and as well to evaluating the stability of every pharmaceutical product. Therefore, at the core of dosage form evaluation is the understanding that drug efficacy and safety are not only determined by the active pharmaceutical ingredient, but also by the formulation itself, the drug availability, the rate at which it reaches the site of action, and its ability to maintain therapeutic level in the bloodstream are highly dependent on the dosage form. These factors are influenced by the choice of experts that are used in producing this pharmaceutical product. The type of formulation as well, either tablet, injectables, or patch, or suspension. Also, and the manufacturing process used in preparing this final product. Therefore, in drug development, there are various types of dosage form to consider. This can range from solid form like tablet, capsule to liquid formulation like syrup and injectables. The complexity of dosage form often dictates that the level of evaluation required. The complexity of each dosage form. Every dosage form are different to each other. The complexity of them require or give them a more processing evaluation. The complexity of the dosage form often dictates the level of evaluation required, with more sophisticated formulation such as controlled release system and biological require additional testing to ensure that the drug is delivered safely and effectively over the desired period. Therefore, dosage form evaluation is not simply about confirming that the drug works but ensuring that they work consistently and predictable. Importance of drug stability in dosage form. Drug stability is one of the cornerstones of pharmaceutical formulation and evaluation. The stability of drug refers to the extent to which it retains its original property, including chemical, physical, microbiological, and therapeutic properties. Drug stability is the process by which a drug retains or composes its physical appearance, chemical properties, and other more. Without truly stability testing, drugs may degrade before they can be used by patients, potentially resulting in adverse effects, reducing therapeutic effect or toxicity. Stability of a drug can have a consequence if it reduces. It's either it reduces the therapeutic effect that it is set on illness or it bring about toxicity because there are a lot of materials used in producing this pharmaceutical product. The chemical properties there we have experience as well. If the stability is not maintained, they either degrade in potential or cause toxic to the host that take this drug. So importance of drug stability in dosage form. That's where, alright, various factors can impact the stability of drug, and this factor must be considered carefully during development and evaluation of dosage form. Factors such as temperature, factors such as temperature, humidity, light, and air exposure are some, and let's say are some the environmental conditions that can accelerate the degradation, the limitation and process of active pharmaceutical ingredients. For example, a drug may undergo chemical degradation when exposed to heat or lighting, or exposed to atmosphere like air. Also, leading to a loss of potency. In some cases, degradation of drug may produce harmful byproducts, as I've said earlier. Stability is something that can predict the efficacy of drug, and also it can is something that can lead to toxicity of a certain drug as well. So stability of drug can also be influenced by its formulation itself, the choice of excipient used in producing it, the manufacturing process, and the method of packaging all play a role in determining the stability of a final product. If we are to use amber bottle with a certain drug, it sometimes amber bottle is something that a little bit dark brownish in color compared to white and transparent container bottle. So all those things can limit the stability as well. So moreover, the stability of drug is not limited to its chemical integrity. Physical stability such as the appearance, structure, and consistency of the dosage form also play a crucial role. Change in the drug appearance, such as decoloration, clumping, or separation, may indicate degradation. So here I say change in drug appearance, such as decoloration, clumping, or separation, may indicate degradation and compromised its therapeutic efficacy. So some drug, there are aspects of the color that may be too green. If the drug they use a pink for the color of the drug, as time goes on, the color may change, which can be used to detect an activity is going on in that drug or a degradation. This actually brought about evaluation and assaying or testing of this drug effectiveness. Given the importance of stability in maintaining the therapeutic value of pharmaceutical products, stability testing is a critical step in the drug development process. Stability studies are typically conducted under controlled conditions, including accelerated stability testing, where the drug is exposed to higher than normal temperature and humidity level to speed up the degradation process. This testing helps to predict how drug will perform over time and determine its shelf life. As you have said previously in our class, shelf life is the duration of the manufacturer and the gap between manufacturing and the expiring the thing. So to dictate the degradation of the drug, sustainability comes in whereby they're increasing the temperature of a certain drug or humidity to speed the degradation of the to determine how long the drug will degrade over time. So now we move into process purpose and scope of in-vivo testing and dosage form evaluation. So this test involving studies conduct in living organisms. We have in vitro, we have in vitro testing, and then we have in vitro that means within which means within a living organism. So therefore, this form of testing is indispensable in the drug development process because it provides a valuable insight in how a drug formulation behaves within a complex biological system. That means this testing help us in predicting how a particular drug acts in a living system. Also, where in vitro testing can provide information about the drug release character, it is under control condition. It's only through an in vivo testing that the full pharmacokinetic and pharmacodynamic profile of drug can be understood. That means in within a living system, in within an organism or a human being generally. Now, pharmacokinetic process part of it is refers to study of how drug is absorbed, distributed, metabolized, and excreted in the body, while pharmacodynamic refers to what the drug does to the body or the effect of drug in the body. And both are things that we need to examine to determine the stability of drug or evaluation of a certain drug, both the pharmacokinetic aspect of it and pharmacodynamic aspect of it. So, in vivo testing allow researchers to evaluate these processes and assess whether the drug is reaching its intended target or site that they have designed for at the correct concentration and for the appropriate duration. This dosage form is all about dictating whether a particular designed drug insert its action on the site that it meant to target on. And then for how long does it exert this effect on this target site? Also, in addition, to evaluate pharmacokinetic and pharmacodynamic of a drug. In vivo testing also provide important information about drug safety and potential side effects. If we do not test this drug in a living system, we will know how effective it is or how toxic this drug is to living organism. So through drug evaluation, we'll be able to know the safety of a drug and its harmfulness or toxicity to a particular organism. So toxicology studies, which are often conducted as part of in-vivo testing, help to identify any adverse effects that may not be apparent in in-vitro study. Because in-vitro is something outside the living organism, but in-vivo is something inside of it. So evaluation helps us to know about the toxicology of a certain drug. For example, a drug may appear safe when tested in the laboratory testing, but cause toxic effect when administered into animal or human subjects. So, this test helps us to detect the potential problem before drugs reach the clinical trial or general circulation. One of the advantages of in vitro testing is the ability to simulate the real-world condition under which the drug will be used for. Also, the body is a complex system and the behavior of drug in the body can be influenced by many factors, including genetic, metabolism, and presence of other substances such as food or co-administered drug. So the evaluation or testing through info can also help us to know the influence of some factor. Some factors such as genetic, because human beings are different genetically treated and what can go on inside of me may be different from how the drug reacts inside of other people. Also the rate of metabolism is different as well. Also the presence of substance such as food, intake of food or co-administration of drug interaction with other drug. So this test allow researchers to take all these factors into account. This testing allow all researchers to take all the factors that I've mentioned into account and evaluate how drug perform in the body. This testing shows that this factor that I mentioned, genetic metabolism, presence of food, it brings to make them into consideration of this factor. If can this drug limit the potential, if there is presence of this factor, presence of food, the metabolic process differ or varies in women. Alright, the scope of in-vivo testing is broad, spanning pre-clinical or clinical and post-market phase of drug. That is, there is level to this testing. That is, we have preclinical, clinical, and post-marketing phase. Preclinical testing typically involve animal study where the drug is tested in various animal models. We often have this animal which is cutting fruit flies because it has a similar metabolism project with whom that's why we use this fruit fly most time in conducting in vivo testing. So preclinical testing typically involve animal study where the drug is tested in various animal models to evaluate its pharmacological and toxicological properties. This study provides important information that helps to determine whether the drug is safe enough to be tested in women. That is a preclinical. We firstly tested in less subjects that doesn't take much life. Women be a higher animals, whereby we do not think harmful properties of a drug. We first have to test them in women, but there are some animal, rather, but there are some animal and rules that guide this process of using animal for testing as well. So animal as a preclinical testing, this study provides important information that help to determine whether the drug is safe enough to be tested in human. Clinical testing, on the other hand, involve so we have preclinical and clinical. So clinical testing, on the other hand, involve human trial where the drug is administered to a volunteer to assess its safety, efficacy, and pharmacokinetic property in human. We, we often have a volunteer for clinical processing or clinical trial for a certain drug. After evaluation with an animal, we move to clinical, which is examine this drug effects and its toxicity in human being before it reaching larger circulation. So clinical testing, on the other hand, so this dual this two approach is essential to ensure that the drug perform well in both animal model and human. Now, testing method in dosage form. In-vivo testing play a vital role in evaluation of dosage form during the development, unlike in vitro testing, which is conducted in the controlled laboratory environment. In vitro testing involves the administration of drug or formulation to a living system, typically animal home, to observe their pharmacological effect, therapeutic efficacy, potential side effects. So this testing allows research to gain insight, more knowledge on how drug interact with the body as a whole, provide a clear understanding of its absorption, distribution, metabolism, and excretion properties. There are several distinct types of in vitro study, each with specific purpose in the drug development process. This includes the study, preclinical study, clinical study, pharmacokinetic study, toxicology study. Preclinical study conducted on animals to evaluate the initial safety and efficacy of the new drug. Clinical study involve human volunteers to assess the drug safety, efficacy, and dosage recommendation. Pharmacokinetic study examine how the drug is absorbed, distributed, metabolized, and excreted out of the body. Toxicology studies focused on determining the potential toxic effect of drug. Through those various testing methods, researchers can make a critical decision regarding the formulation, dosage, and potential risk associated with drug before it's introduced to human. Now, under clinical testing method, we have phase 1, 2, 3, and 4. Under phase 1, the primary subject of phase 1 clinical trial is to assess the safety and tolerability of drug in human. This phase is just based on how safety and how women be tolerate this certain drug property in their body. This study is typically conducted with small group of 80 volunteers and involving escalating dose of drug to determine the maximum tolerant dosing. Phase 2 involving large group of participants, typically those with disease or condition the drug is intended to treat. This goal of this phase is to assess the drug efficacy and further evaluate its safety profile. Researchers also begin to determine the optimal dosage and dosage schedule for this drug. Phase 2 large-scale study that assess this drug effectiveness in a broader patient population. The study provides more comprehensive data on drug safety and efficacy as well as any side effects or adverse effects that may occur in real world. Phase 3 which is post 4 which is post-market surveying after preclinical, clinical, and then the phase 3 to the broader larger people, the post-market surveillance, which means the feedback of this certain drug after they discover a drug, test it on 80 volunteer, and now testing it on other it's a related issue that it was produced or designed for. Now, we test it on general people. After people have been taking this thing, then we have to ask for the real feedback of it. If this drug really exerts the purpose of its production. Now, in conclusion, in-vivo testing remains a cornerstone of dosage form evaluation, providing a critical insight into the pharmacokinetic, pharmacodynamic, and safety profiles of drug formulation. As drug development becomes more complex, the importance of in-vivo testing is heightened, especially in the area of efficacy prediction, safety assessment, and optimization of drug formulation. The integration of new technologies and the shift toward more relevant testing system promise to enhance accuracy, ethical standard, and cost effectiveness of this evaluation.
All right, thank you very much for the presentation. That was a good one, and and sorry for our viewers. This lecture is not this presentation is not a video. It's not video. This one is purely audio, and we allow the presenters to choose the one they want. So this the presenter preferred audio. So that's why you are not seeing who is presenting. But the most important thing is that you are following us. So today we end our today's presentation. Tomorrow we'll start again at exactly 10 a.m. We'll start our presentation tomorrow, being Sunday, Sunday by 10 a.m. We'll start our presentation. We have a lot of things to present tomorrow. And please be with us on Facebook, be with us on YouTube. So on Facebook at Chetanna 83, then on YouTube at Chetanna TV. So be with us, and God will bless you as you do so. Please share these lectures, share these presentations. If you have any question, feel free to drop it on the comments section. Please share with your friends. Subscribe to our YouTube channel, Chetanna TV, Facebook page, Chetanna TV, and Facebook profile, Pharmacist Ezeanya Emmanuel Chetanna. But the live lecture on Facebook is on Pharmacist Ezeanya Emmanuel Chetanna. That's my profile. While on YouTube is at Chetanna TV. That's my YouTube channel name. So the live lecture, the live presentations will be aired on these two social media handles. And God will bless you as you join us. See you tomorrow, 10 a.m.